Has she had any problem with her shoulder before? Or is this new?
Yeah, she said it's new.
Okay, okay. So she's been sick for how long?
We have the resources and the training to be able to meet each individual and find out what barriers each person has and start systematically breaking it down into workable pieces with them so that they can start to climb out of the hole that life has put them in.
Anybody is capable of homelessness. I've been homeless. I know where these people are coming from and where they've been.
I used to go down and camp out down by the freeway and some of those fields down there. I was having trouble being attacked camping out. People robbing me and assault. I was afraid that they'd really injure me.
We see a lot of people that are dealing with medical issues, and they're not the type of individuals that have regular doctors that they could go to. And so having the mobile health care unit here really helps us because they are here twice a week. And as we are looking at somebody's life and helping them look at their own life and see what things need to be changed and what things need to be addressed so they can succeed more in our community, healthcare is one of those major things. Time and time and time again, people have healthcare issues that just have not been addressed.
If you look at homeless people, the average has 12 emergency room visits a year, which is very expensive, and we see that. The people we see on the van, their primary source of health care is the emergency room. In terms of getting primary care, there are several community clinics in the area that would see patients regardless of their ability to pay. But when people are living on the streets, their lives are chaotic, they've been traumatized, there's a lot of reasons that they can't get to their appointments on time, they can't get a ride, they don't have telephones, there's so many barriers. We don't think about that. We think we'll make an appointment, we drive there, but if you don't have a home or a phone, you don't have clean clothes to wear, you maybe don't have shoes, you can't go. And so for those folks, there's really not anywhere else for them to go. There's the mobile and there's the emergency room.
People that work here, especially on the mobile, are people that have passion for this kind of work. People that wants to make a difference in the world, and especially a difference in this population that are so put aside. So you have to have some compassion and understanding and non-judgmental way when you're dealing with this population.
The mobile health unit is an amazing resource, in my opinion, for the migrant population. Many that work there, not all, but many of them are here on work visas, and because of that, they don't qualify for Medicaid or Medicare. They don't have insurance, which means that everything that they receive medical-wise is very expensive for them. And most of what they make, they send home.
A lot of times people don't get the care they need when they need it because it's just too difficult. And so the idea that you can travel to a person's neighborhood, to me, just makes it less intimidating, more reasonable, and many things that people need medically are not that complicated. Sometimes we think that you got to have all these tests and labs and imaging and medications, and many problems are much simpler than that, and we can address them with a lot less.
We were at one of our sites, and this gentleman comes up, and he could barely walk. He was kind of, I would say, almost crippled. We got him registered, and he said he needed somebody to cut his toenails. And I'm like, yeah, I think we can do that, So I called the nurse out, and And when they took his shoes off, his toenails were so long that they were sticking into his shoes, and they were kind of bent over. And the reason he couldn't cut them was because he had had hip surgery and hip replacement, so he couldn't bend over to cut his toenails. So the nurse got out there and we got him all set up and got his toenails cut and everything. And next thing you know, this guy's done. He gets a new pair of socks and he gets his shoes on, and he's dancing in the parking lot. He was dancing in the parking lot, and I mean, that paycheck was huge, the heart paycheck.
They're caring, they're very caring, muy amables todos y muy buen equipo, muy amables, se preocupan por las personas. Pero muchos casi no están impuestos a venir al doctor. Entonces, invitar a todos que se vengan.
Heart paycheck is when you help somebody that, you know, I mean, in my eyes, that you help them and they come out on the other end a better person and healthier, and you build up these relationships with these people, and they actually become your friends, and you know, they're actually really decent, nice people.
This is what I want to do. This is, to me, this is what healthcare should look like. Is everyone should have the healthcare they need when they need it without worry about financial hardship. And being here, I get to do that. So I feel privileged every day to have that opportunity.
The medicine I got from the mobile unit really helped me out. I take heart medicine, and the pills take a lot of pressure out of living. It helps me think clear. Yeah. Medicine's pretty important when you're in pain.
It's been great. I mean, Bob and all them have been really helpful. They got me on OHP and got me going, and got my medicine back on track. So it's been great.
When I was little, I needed a lot of help myself. So I came to the Clinica when I was 12 years old, and I decided that I was going to work for them one day just because of the work that they did, helping people that needed the most help. And I've been here for almost 15 years.
You know, I actually went to school to become a minister, and I found more ministry out on the street here working for La Clinica than I ever did standing behind the pulpit.
I get out of bed excited to go to work, you know, and to me it's not even work, it's fun, it's enjoyable. I mean, yeah, you have your moments, you know, where you're like, oh my gosh, you know, because you see somebody that's in pain or severely sick.
I love my work. Yeah. There's just something so real about it, I guess. And it feels good at the end of the day. And it's a real position of privilege.
Really just listening to their stories lets them know that they're heard. It lets them know that they're valued. And really that's at the heart of homelessness, it's at the heart of mental health, it's at the heart of addiction. Self-value, putting away shame, letting them know that they matter in someone's eyes and that they should matter in their own.